Welcome to the live checkup. This is where we sit down with Dr. Asante LeBlanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante LeBlanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the Eastern and Western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic _Trinidad. Website www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hey guys, welcome to another episode of the live checkup. I'm JD, and along with me, Dr. Asante LeBlanc. Welcome inside another episode of where we just try to find out all we can from the doctor herself. And I always say thank you so much for the doctor to give us a little bit of her time today inside of another episode. So first up, let me say good evening to you and how you doing, Doc?
Hi, JD. Hi, everyone. I'm doing well.
You sound
It's been a rough. It's been a rough week with the Sahara dust, but I'm okay.
Okay, good. And it's good to have you here. So, guys, you would have seen and heard so much more about the doctor at the beginning of this episode today. So, just contact her and send all the details there as well. And I'm sure you can find out more about your visit or heading to Victoria Clinic. So, Doc, most recently we had some really engaging conversations and some conversations that took you back just a little bit in terms of, just finding out so much more. Most recently we spoke about vertigo, and I know Gina's really happy with that. She says, thank you, by the way. So, today, though, it's going to be the challenge for the tongue twister for me. Hold on. Let me make sure I get it right. Hold on. Today, we are speaking about endometriosis. Did I get it?
Close.
Oh, God.
Endometriosis.
That's endometriosis. That's the topic of conversation for today. So we encourage you to post your questions right here inside of the live chat, and we will certainly get the answers from the doc in case I did not present them to you. So let's get straight into it, Doc. What is endometriosis?
JD, endometriosis is where the inner lining of the uterus is called the endometrium. Mm-hmm. And endometriosis is where the endometrial deposits are outside of the uterus. So it can go outside of the uterus. It can go on the surface of the uterus. It can go in other parts of the pelvis. It can go down to the vagina, the cervix, the lining of those organs. It can go as distant as your liver, your lungs, your rectum. So it's where these deposits, they're endometrial deposits, and they go out. They can go in the ligaments that hold up the uterus, and they deposit in there. And therefore, what happens is the lining deposits, the endometrial deposits, actually react to your hormonal changes. Right. Hence the symptomology that you get, depending on how bad it is.
So, Dr. LeBlanc, what causes them to go to those different locations you spoke of?
Nobody knows.
Nobody knows. That's one of the biggest secrets, right?
The risk factors are not well known, not clearly known. There is talk of hereditary. There's talk of maybe our diets as we got more and more so-called sophisticated in the modern world. Mm-hmm. But what we do know is that this exists. And it's been around for years, but it seems to have been getting worse over the years in women, almost to the point of causing infertility in some women, really debilitating disease in some others. I mean, and the signs and symptoms vary so much from woman to woman that it's quite an interesting and intricate disease of the female reproductive organs.
All right, so well then I gotta ask you this then. what are some of the signs or symptoms that a woman can see that can possibly indicate we need to go speak to you, the GP, and find out if it is that?
So, JD, a lot of it has to do with extreme pain during your periods, or what we call dysmenorrhea, but
Mm.
also importantly, ovulation pain.
Right.
So, pain during ovulation that no one can describe properly. Sometimes you get pain during sex, dyspareunia. Sometimes you get pain or bleeding after sex. Sometimes you get just pain with even a vaginal examination, painful urination, the bleeding can be very irregular. So your periods can be very, very long, extremely painful, or just very irregular as well. You can get lower back pain. You can get pain in your rectum when you're ovulating or having your period. You can get abdominal pain that just seems so unspecific. You can get, if it goes to your lungs, shortness of breath and other symptoms. So it really varies and depends on where the deposits are.
So, and again, you're not talking about just one type or one sign, because you can get pain in the rectum or you can get really horrible period pains, as you say. So, what is that indicator then that makes one come straight into the doctor and say, something's up? Is it that I have a combination of a few of those, or just one off can speak for itself?
That's a good question. I think it's important to understand that you have to look at the pain and is it cyclical in nature? Because these are endometrial deposits.
Right.
So, based on your hormones, it will be cyclical most times. And you have to look at the pattern of the pain. I know most endometrial sufferers that I have seen in my office, they have it down to a T. They know what happens on this day, that day.
Right.
They know when it's coming. They know what irritates it. And they can give you a diary, and that is so important because that helps to break down or demystify and then point the doctor in the right direction in terms of what they have to do, in terms of the workup. And so it's very important to classify the pain and to understand the pain, and don't get pain. If you get one painful period 1 month, I'm
Right.
not saying don't go to a doctor, but I would personally advise wait and see the next cycle. Wait and see the other cycles, see ovulation, see how it goes. So when you go to your doctor, you're able to say, look, on day 14 of my cycle or on day 10 of my cycle, this started to happen. Then on day 20 of my cycle, this started to happen. And this has happened for the past 2 to 3 months. So you give a history and you arm versus the GP saying to you, or the doctor saying to you, I should say, oh, well, can you go back and put it in a diary? Do you, or when you sit down, they go, do you notice anything
Yeah.
in particular about it? And you're like, well, I don't know. So, I mean, all of us have phones now, smartphones, and you put your periods in. You never
On
know
these
when your
apps.
last
Yeah.
period was, all those apps. So, it's very important. They have flows, notes you can put in. So, if you aren't able to write, type in what is happening. So, believe it or not,
Yeah.
just pulling that up in the office is important because it demonstrates to the physician that you have some kind of history with it.
And that's so true because, again, technology is affording us that ability to do that. So we don't have a reason for not journaling. And it's one of the things that I do as well. I try to note down when it's a very horrible day or if I'm bleeding heavily, etc., etc. So I hear you with that. Are there different stages, if I can say, of endometriosis? I hope I got it
You
right
got
this
it
time.
right then,
Oh,
yes.
yes.
There are about 4 stages, and it goes from mild to very severe. And it's all in degrees of pain and degrees of other symptoms with the bleeding
Symptoms.
and then infertility. So there are different stages. You can worsen from one stage to the next, but it's important to understand that most people have mild to moderate, and then they have the few that have very severe symptoms.
You said most. So let me just put you on the spot here, right? Is this, I know, you said most, and I'm guessing that you see a lot of women dealing with this. Is it something that's very much aligned to one's ethnicity compared to
No,
others?
I must say no. I haven't found it. Like with fibroids, for example, we definitely see a risk factor and association with African
Yes,
descent.
yes.
But with endometriosis, I have not noted a specific ethnicity. I've seen more multi-ethnic
Yeah, yeah, yeah.
populations.
I,
So and I find that it's not predominant, at least in my practice. I don't see that as
And
well.
that's why I wanted to ask that question, because I know with the fibroids, it's more so in terms of African women. So I was just wondering if that is another one of the things that African women have to deal with, or should pay
Well,
attention
they
to
do, but I haven't seen them being more afflicted by it.
by it. Yeah. So, okay. So someone is seeing the signs and all that, they come in. What is the treatment or some sort of, what do we do? Is it surgery? Is it,
So as yeah, so as a physician, we generally would like to refer you as a general practitioner to a gynecologist.
right?
It really, I mean, you must know when to refer. That's very important. So the gynecologist will generally do a very detailed workup. They will start on hormone therapies, which usually involves the birth control pills or OCPs, or contraceptive pills. Um, and also regular pain treatment and painkillers. I mean, I'm telling you the typical Western medical approach to this. Um, and then eventually, based on your response to therapy, they may do what we call laparoscopy, or a laparoscopic exploration, which is where they go in with minimum access to actually view the uterus and view the lining, and in some cases, take samples so as to do a biopsy and pathology to see if we are identifying endometriosis.
I love chatting with you, and you know that, right? Because I always would have remembered learning something before, and I can bring it back in our conversation to date. When I was, every year I come to you, of course, Dr. Asante Leblanc is the chairman of the Trinidad and Tobago Cancer Society. So, I go there all every year to do my PAP, my so and so, my so and so. Like the PAP can pick up certain things you speak of. Is there any test that we should be doing, a screening that would pick up something like that?
No, there's no
And
screening. So it's based on symptoms, and then there's no screening. So remember, screening is looking in a normal population for the disease. So the definitive diagnosis of endometriosis is through laparoscopy. And during laparoscopy, they can also remove some of the deposits and treat surgically, right?
right,
So it's important to understand that. And then with the Western approach, more and more, they're trying to incorporate a more holistic view in terms of your diet, what you eat, how you eat, in terms of your eating as natural as possible, not having a lot of external hormones. In terms of the chicken, we know the big chickens that are, 5 cents a pound, or chickens that grow in 2 weeks, to huge sizes. So it's very important to incorporate that aspect from a Western standpoint. From a Chinese standpoint, well, you want to ask a question?
no, I was going to say go ahead and do the transition into it, because this is what you're known
Right. So
for.
I
Yeah.
find it, I must say that this is a disease that I do believe should be treated. I believe everything should be treated in an integrative manner and very holistically.
Right.
But endometriosis does, to me, the endometriosis patients do benefit from bringing the two together, definitely. And I have seen many patients benefit from use of herbs using specific Chinese formulas.
Right.
I myself do different formulations depending on the symptoms, but also from acupuncture and cupping, to help with the flow and basically balancing the body. Because when you look at it from a Chinese medicine perspective, you're not just looking at endometriosis as the disease, you're looking at the patient as a whole and identifying what is going on in that patient.
Right.
And therefore, you're getting more of the root of the problem and not just the branches. And so you see if there's stagnation, you see if there's deficiency, you see if there's a yin yang imbalance. You look at the patterns, and based on that, you can formulate a strategy which incorporates your diet, your exercise, your herbal therapies, and your acupuncture, cupping, moxibustion in some cases. And I do see, I must say, this is one of the diseases, JD, that I find amazing when I look at patients and I don't see them as endometriosis patients. I just see them as a traditional Chinese medicine patient. And you say, what are the patterns being seen here? And you treat that. And it's amazing to see. I mean, I've had patients who would have a characteristic loss of voice, fatigue, just a total debilitation with their periods. And in their mind, this is all endo, right? And endometriosis. And when you treat them, not thinking only of endometriosis, It's amazing the miraculous path that you can go through, and it's important for everyone to understand that it's not about, we all want you to be cured, that's for sure, but it's about balancing the body and supporting the body and bringing it into such a balance that you're amazed at the transformation, to the point where you say, from taking a cocktail of Panadine, Buscopan, morphine, Tramadol, and all of that, you're taking just Panadol. So it's important to see the glass move from half empty to half full. And it's important to see the transition of quality of life in the patients. And that is what I like. I like to see.
So what I'm getting
and
from
promote,
you,
promote.
So what I'm getting from you is that there is the possibility of that transition from a very painful life of having to deal with this, coming down to just maintaining it, just work. I don't even want to say working with it, but eating a different way, treating yourself differently to be able to just balance yourself and deal with it painless, painlessly.
And I don't want you to think that you don't have to use Western medication. For example, I have patients that I use both in Western medication and the herbs and the acupuncture. And, we may use birth control in some patients, we may not. But the reality is that there is support. And there's a huge endometriosis organization in Trinidad and Tobago as well. And a lot of these groups are amazing in terms of describing their journeys, and the resources are out there. And I think it's important to understand that the support is there, and to understand that to me, it has to be done in a very holistic and integrative approach. And it's not even just a GP, as I told you, it's a GP, a gynecologist, a certified herbalist, an acupuncturist. I think all need to come together.
One more question about that. So are you saying that with the combination of all that, all those players working together, is one going to move from, and I want to use this word, maybe it being inflamed to now being very much toned down and controlled, because it's not going to go away.
In most cases, I think it does. There are the one or two cases that they're really difficult, and the women may have even had to have hysterectomies, which is taking out their uterus. And yet they've done that and still have pain. I've seen women who've had surgical removal of the endometrial deposits and still have pain. So it is a process, it's a journey. And I think that is why it's important to look at the patient as a whole, because it's not only about their uterus, it's not only about their endometrial deposits. There's a lot more to look at.
Sorry, you go ahead, please.
So I really agree with you. Yes, most people can get help, and the sooner you seek it, the better. But there are one or two that we need to constantly work with, for sure.
So here's another question. What happens if it is left untreated?
If it's left untreated, I mean, it depends on the stage that it's at. But I mean, the pain is sometimes debilitating. So the quality of life may be poor for the person.
So you would go get it treated.
So I doubt you'll leave it untreated. I think maybe it's very mild, then you leave it untreated. But I doubt if you have a lot of pain every month, debilitating, quality of life may force you to finally seek treatment.
All right, so we touched on everything there pertaining to endometriosis. I'm so proud of myself.
You're getting close. You're getting close.
Close, I wasn't there. So are there any final points you want to touch on before we wrap up inside this conversation? Because I know you got so many things to do, and I really appreciate your time.
It's been a hectic week, and I appreciate your time as well, because it's really been a hectic week for me, but I appreciate and I'm blessed about the hecticness of life.
Yeah.
But I sat the other day, JD, and I said, Asante, you preach to everyone about self-care and overwhelming, and I have not taken that breather that I need. So I really did have to sit back the other day and say, stop, So I really appreciate your understanding over the weekend when I could not take it was really just me doing some self-care. But in terms of how we should finish, JD, it always boils down to taking care of yourself. It boils down to knowing what is happening with your cycle, understanding your body. It boils down to integrative, wholesome lifestyle. It boils down to the same thing: balanced diet, exercise, and then the other things that we discussed in terms of what it's for you individually. So, JD, I think most importantly, I want people to understand that endometriosis can affect your mind. It can affect your mental health, because it's very debilitating when you have so much pain all the time, when you literally hate your period. when your period is just part of your reproductive life
Yeah.
cycle.
Yeah.
And so it's important to understand that don't get to that point, seek help, don't give up. There's support out there. And don't, you know, yes, look on Google. Googleitis might help in this stage in terms of pointing you in the right direction of what can be done. But I do think reach out to your
Of course.
doctor, speak to your gynecologist, get an understanding, and don't be afraid. And we're here to help however we can and promote a healthier lifestyle.
Well, I thank you so much, and we always appreciate you with the info on the live checkup. Guys, one thing I was thinking about as you were speaking, gentlemen will say this is not for us, but it is because you may have a wife, you may have daughters, and you just don't understand why they're in such pain or why something is happening as it is. So, this is another one of those platforms you need to share with them, male or female, just share and click like and subscribe. So, we thank you for that. Dr. LeBlanc, we are still living in this mad world called COVID
Yes.
19, the pandemic, even though the vaccine is a talk around town right now. What are your final words as one of those essential workers on that topic as we get ready to wrap it up and head out?
JD, COVID-19 is here. It's a pandemic, and I would like everyone to understand the vaccine does not equate to not using your mask properly over your nose and mouth.
Mm-hmm.
It does not equate to not washing your hands or sanitizing. It does not equate to coughing freely. It equates to still maintaining those practices that we've had all the time: social distancing when you can, washing your hands or sanitizing, wearing your mask properly, covering your nose and your mouth. We have to understand the vaccine does not equate 100% immunity. This is still a work in progress. We do not know how much immunity and how long the immunity will be given with the vaccine that we have. And I think it's important to understand that. It's important to know that this pandemic is here with us for a while. It is going to be a marathon. We can do it. And Trinidad and Tobago has done wonders. WHO has congratulated the
Yes.
government. Hoorah, hooray. However, there's still a lot of work to be done. And it's important to understand that, the virus may decide to change on us. The virus may decide to
Another
do
variant.
something else.
Yeah.
So we need to just be calm and let it play out and see how it goes, and be kinder to one another, because I think COVID is bringing out the worst in some.
Yes.
So be kinder.
Impatience too.
Let's be positive. And I do understand the impact on mental health, and therefore I would like us to touch on
Anxiety. We have that.
anxiety
Yeah, we have that
next
coming up.
week, because JD, more and more I am, I always say that the definition of health is the balance of body, mind, and spirit or soul. And more I am seeing the telltale signs of the imbalance of the mind and the psychosomatic diseases coming out, and just the fear of death and the fear of impending disease, and just something must be wrong. Something must be wrong. And so it's important that we touch on it, and we can share some very easy hacks, that work at home, in terms of how to cope with it. And I mean, I may seem like a perfect model, but I am not. JD knows that I go crazy sometimes.
And I go crazy
And
sometimes.
I am very open to letting everyone know that I deal with my emotions very frankly. I identify them and I move on. But you must be very comfortable with yourself and your family and your support systems, and know that you're not alone. COVID-19 has rendered a lot of changes and has impacted on us financially, on the whole,
Mm-hmm.
mentally, and
With
physically,
education,
and,
yeah.
and everything. So I think it's important to know that we do have to reinvent the wheel, so to speak. And JD, when COVID first started, you and I did a lot in terms of how we appreciated the sun, the birds, and I notice now that they're opening up slowly. If you haven't noticed, I've noticed it, that I'm falling back into the rat wheel,
I
and I'm
said this on
trying,
radio just
and
Tuesday.
and
I
I'm trying
did.
to get back out. I'm like, nope, it's not happening, and I'm trying to backpedal. So I think it's important for us to have these discussions, and I really would like us to do maybe a two-part series on it, because it's very important to understand that I think we have to try and identify new ways to cope.
Yeah.
And we have to identify new ways to put a stop to the madness, and make it our lives, not make it society's life.
I look forward to that
So
discussion because coping is something many persons are not dealing with as best as they can, myself included, coping, whether it's in financially, whatever it may be. And as also, I think that conversation needs to also target the men, because let's be real, some men are not coping with this as they believe they should. And
Either they're not coping or we're just seeing more of it. But damn, I mean, sorry. I mean, but really, fellas, come on now.
Sit down here. Yeah. So it's a conversation to have. Yeah. Definitely. But one of the things before I wrap up, what I take from what you're saying, it seems as though that we are not heading back to 2019 BC anytime soon. Anytime soon. And
I don't envision that. I think we're going to have a new AC. Yeah, we're not going to have a BC. We're going to have a new AC. And a DC, which is during Corona.
Corona, exactly.
So we're going to have a DT AC kind of situation. So it's going to be a ride. I think it's a ride, and I think it's what we make it, to be very honest.
Thank you very much, as always, Dr. Asante LeBlanc, for your time, and thank you as well for looking on and sharing this with all your friends and your family.
Yes.
Thank you so much.
We do this every week because we know you depend on us, and we enjoy it, and I think it's so important. I look back at these segments, JD, and it's. I say, did I say that? Did JD say that? And I'm like, wow, oh my God. So
what I love is that you said you're actually showing it in the office as well, and I appreciate that too.
Yes, it's in the office streaming, and everybody's like, and so I'm trying to get people to subscribe to your channel and follow us, because it's important, I think, and not only just for us as what we do, but also because of the wealth of knowledge and the wealth of information, and so that you know that I am not the know-it-all of everything, but as a GP, I just try to break it down the best I can, as you would if you came into my office. Yeah?
Appreciate it. I know your list is long for the rest of the evening, so let me leave you. Thank you so much, as always, and we'll connect because we're doing this bi-weekly, actually. Yeah, and we're working on also making that transition onto another platform. We'll keep.
Oh my word! I can't wait! I'm so excited. Yes.
So thank you as always, Doc, and thank you to our viewers. One day we'll be saying listeners. Did I let the cat out of the bag? Anyway.
I don't know.
Thank you very much. And take care. I'm JD. God bless.
And that's it. Another episode of The Live Checkup with Dr. Asante LeBlanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante LeBlanc, don't hesitate to connect with us. In fact, send that email to jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com.